The driving rehabilitation field is very specialized and it's not really taught during the regular OT curriculum at university. So I was really happy to find it all in this program. The flexibility of the program was amazing. It enabled me to study almost everywhere, at home, at work, in the train, at the coffee shop, and I really appreciated it.
I could have never have done that certificate if it wasn't for the flexibility it allowed me. I was able to continue to work part-time, I was able to manage my family, I was able to do the certificate from home. I was able to review the guidelines, standard of practice, the norms that were relevant to that specific field, and that was all available through my computer, so it was amazing.
While students may be able to learn theoretically how decreased visual processing speeds or a deficit in divided attention skills may be detrimental to driving safety, they certainly have a much deeper understanding of this when participating in their first on-road evaluation with a client who has difficulty in these areas.
Having the students come into clinic to do their clinical placement not only solidifies their theoretical knowledge, but it brings their understanding to a completely different level. It's really amazing to watch as everything falls into place as the stage progresses. And they're able to work with a real driving instructor, with real clients, and they can go on the road and practice driving with adaptive driving equipment. It really provides an experiential learning that we can't reproduce in the classroom.
So the clinical placement was a crucial part of the certificate for me. After studying for a year and a half online, I needed to experience the equipment, to be able to understand how it works and to be able to make the bridge between what they are and the needs of my patients. So by being here in clinic with a real patients to be able to manipulate all these equipments was perfect.
The opportunity to observe an experienced clinician provide feedback to a client who has not done so well on the road test is much appreciated by the students. The tips and hints that are learned from the experienced clinician add so much to the program, and it's really not something that can be offered in a formal lecture setting.
The program was created in 2002 in response to a need identified by the clinical community. It was developed in collaboration with the occupational therapy licensing body as well as the automotive licensing authority. Today we continue to conduct research in different areas of the full spectrum of driving rehabilitation, such as developing tools to screen or assess individuals who may be at risk for driving, or to develop or assess new interventions to retrain some of the driving skills or assist individuals who may need to retire from driving. This ongoing collaboration between researchers and expert clinicians has really contributed to the development of the program. It has also ensured that the program really is at the forefront of the latest development in research, making it really clinically relevant for today's clinical practice.
As a community OT, I realize that I am much more prepared now to screen clients who need a full driving evaluation and also to refer clients who need a vehicle adaptation to the appropriate resources.
Many of our graduates have been hired by well-established driving rehab programs or have gone on to open their own private practices. We've had students from all across Canada and even a few international students. The large majority have gone on to pursue career in the field, and a lot of them actually act as supervisors for the current students in the program. A few of our graduates are already being recognized as the driving experts in their own provinces.